Have you ever wondered how millions of perfectly normal people suddenly became patients without ever feeling sick? Imagine waking up one morning exactly the same as the day before. Your body feels fine. You go to work, spend time with your family, and live your normal life. Then you visit your doctor for a routine checkup, and suddenly you're told you have high blood pressure, high cholesterol, or prediabetes. Nothing changed about your body overnight. So what changed? The answer may surprise you. Today we're diving into one of the biggest health controversies of our time. More than 115 million Americans are now classified as having diabetes or prediabetes, and millions more have been diagnosed with high blood pressure and high cholesterol. But is this massive increase because people suddenly became unhealthy, or is there another explanation? Stay with me until the end because the truth is far more complicated than most people realize. Whenever we investigate a health mystery, there are two important questions we should ask. First, when did the problem begin? Second, what changed just before it started? These two questions often reveal clues that many people overlook. If we look at the history of chronic diseases, we notice something unusual. Rates of diabetes, hypertension, and high cholesterol did increase gradually over many years. But then, at specific points in time, the graphs suddenly shot upward. These weren't slow increases caused by lifestyle alone. In several cases, the definitions used to diagnose these conditions changed, meaning many more people suddenly met the criteria for a diagnosis. Take high blood pressure as an example. For many years, a blood pressure reading of 140 over 90 was commonly used as the threshold for hypertension. Later, new guidelines lowered that threshold to 130 over 80 in some countries. Overnight, millions of people who hadn't changed physically were now considered to have high blood pressure. Their hearts didn't suddenly become weaker. Their arteries didn't change overnight. The numbers defining the condition changed. A similar situation happened with cholesterol. Years ago, higher LDL cholesterol levels were considered acceptable. Over time, the recommended limits became lower. As those guidelines changed, millions of additional people qualified for treatment, often with prescription medications. Then came prediabetes. This category was introduced to identify people who have elevated blood sugar levels, but not high enough to meet the criteria for diabetes. While many experts believe identifying risk early can help prevent future disease, it also meant tens of millions of additional people were suddenly labeled as having a medical condition. This raises an important question. Does receiving a diagnosis automatically improve your health? The answer isn't always simple. A diagnosis can be extremely valuable if it encourages healthier habits, earlier treatment, and prevention of serious complications. On the other hand, unnecessary testing or treatment may expose some people to medications they might not actually need. This is why many medical experts continue to debate where diagnostic thresholds should be set. Another issue often discussed is conflicts of interest. Some critics argue that members involved in developing clinical guidelines have had financial relationships with pharmaceutical companies. Others point out that these relationships are disclosed and managed under strict rules. Regardless of where you stand, transparency is essential. Patients deserve to know how recommendations are developed and what evidence supports them. But here's the part many people overlook. Even if some diagnoses have expanded because of changing definitions, chronic disease itself is still very real. Heart disease, type 2 diabetes, obesity, and metabolic disorders continue to affect millions of people worldwide. So what actually drives many of these conditions? One of the biggest factors is insulin resistance. Insulin is a hormone that helps move sugar from your bloodstream into your cells where it's used for energy. But when insulin levels stay elevated for years, your body's cells become less responsive. Your pancreas has to produce even more insulin to achieve the same effect. This process is known as insulin resistance. Over time, insulin resistance can contribute to elevated blood sugar, increased fat storage, abnormal cholesterol levels, fatty liver disease, and higher blood pressure. That's why many doctors refer to it as one of the central problems behind metabolic disease. What causes insulin resistance? For many people, It's a combination of factors rather than one single cause. Diets high in refined carbohydrates and added sugars can contribute. Lack of physical activity plays a role. Poor sleep, chronic stress, excess body fat, and even genetics all influence how the body responds to insulin. The good news is that lifestyle changes can make a remarkable difference. Regular exercise helps muscles use glucose more efficiently. Strength training builds muscle, which improves insulin sensitivity. Walking after meals can reduce blood sugar spikes. Losing even a small amount of excess weight often improves metabolic health significantly. Nutrition also matters. Eating more vegetables, lean protein, healthy fats, legumes, nuts, seeds, and whole foods while reducing sugary drinks and heavily processed foods can support healthier blood sugar levels. Many people also benefit from limiting refined carbohydrates, though the ideal approach varies from person to person. Sleep is another powerful medicine that many people ignore. Just one night of poor sleep can temporarily reduce insulin sensitivity. Chronic sleep deprivation increases the risk of obesity, diabetes, and heart disease. Stress management deserves attention as well. When stress hormones remain elevated for long periods, they can interfere with blood sugar regulation and encourage unhealthy eating habits. Regular physical activity, meditation, spending time outdoors, and maintaining social connections can all help reduce chronic stress. Now let's talk about medications. Prescription medicines have saved countless lives. Blood pressure medications reduce the risk of stroke. Cholesterol-lowering drugs can significantly reduce cardiovascular risk in the right patients. Diabetes medications help control blood sugar and prevent complications. These treatments should never be stopped without discussing it with a qualified healthcare professional. However, medications often work best when combined with healthy lifestyle habits rather than replacing them. Diet, exercise, sleep, and stress management address many of the underlying factors that contribute to chronic disease. Perhaps the biggest lesson from this discussion is not to panic over a diagnosis. A number on a lab report doesn't define your future. Instead, use it as information. Ask questions. Understand your risk factors. Discuss your options with your healthcare provider. Learn what changes you can make that may improve your long-term health. At the same time, don't ignore warning signs simply because you feel fine. High blood pressure, high cholesterol, and prediabetes often produce no symptoms for years while quietly increasing the risk of serious complications. That's why regular checkups remain important. Health isn't about chasing perfect numbers. It's about building healthy habits that improve your quality of life year after year. So, did 115 million Americans suddenly become sick overnight? Probably not. Part of the increase reflects changing diagnostic definitions, while another part reflects genuine increases in metabolic disease driven by modern lifestyles. The reality lies somewhere in between, and understanding that difference helps us make better decisions about our own health. If there's one takeaway from today's video, let it be this: don't focus only on labels. Focus on the habits that truly improve your health. Eat better, move more, sleep well, manage stress, and work with a trusted healthcare professional to understand your individual risks. Those steps will always matter far more than a number printed on a piece of paper.